This is Dr. G.P.V Subbaiah, spine surgeon, Care Hospitals, High Tech City, Hyderabad. We are now in COVID pandemic. So I see a lot of patients coming to me. They are asking me whether back pain is a symptom of COVID-19 or we are prone to develop back problems during these times. So there are three scenarios under which we can have back pain in these COVID times. The first scenario, the patients who had back problems already before diagnosed as some disc disease or arthritis of the spine or some degenerative condition of the spine, having a problem before COVID, and because of COVID scenario, because of restricted physical activity or restricted exercise activities, these problems can become worse and they experience increased back pain. This is scenario 1. And scenario 2 is they never had back problems before COVID times, and again because of the restricted physical activity and inactivity, basically sedentary lifestyle, they can develop back pain. And third scenario is because of COVID, patients can have some amount of back pain. So all of us know that COVID can cause generalized body aches. They can have neck pain, they can have shoulder pains, and along with these pains, they can have low back pain. I've seen quite a few COVID patients having low back pain, severe low back pain, especially between the 2nd and 7th day. That means in the first week of COVID-19, patients can experience low back pain. But some of the people, they can have back pain for prolonged periods of time, like few weeks they can experience low back pain. So back pain can be a symptom of COVID-19. So if you develop fresh back pain without even without fever, it's wise to rule out the possibility of COVID-19. So how to avoid these back problems during this pandemic time? The first important thing is physical activity. We have to plan some sort of physical activity every day, like walking, and if you can do jogging, cycling, all these things you can do in this COVID time. So some sort of physical activity, one. Second thing is stress, anxiety can cause low back pain. This we know already. So COVID means, if we say corona, people are becoming anxious. So this anxiety in itself can cause low back pain. We should try to find means of reducing our anxiety. So second thing. And third thing is most of the people are working from home. So they are not maintaining proper posture, and as a result we can develop low back pain. So what is a proper posture while working, or at least working from home? You should sit in a chair of at least this height, and your back should touch the chair, and both your feet should be on the ground, and while sitting your knee should be at a lower level compared to the hip. So that means you should avoid sitting down on the floor, sitting cross-legged, avoid sitting on low-lying chairs, low-lying stools. So you should sit in a chair of this height. And the other important thing is even prolonged sitting can cause, in a right posture in itself can cause low back pain. So that is the reason once in every half an hour, 45 minutes, you should get up, move around for 1 to 2 minutes, then sit back. So these are the important things you should do to avoid back problems during COVID pandemic. Physical activity, reduce stress, and proper sitting posture.